Welcome to the deep dive. Today we're getting into the treatment options for advanced prostate cancer. We've got some specific information to work through here. The main challenge really is always how best to manage the disease once it's, moved on a bit. And our sources are focusing on two key things. Androgen deprivation therapy, ADT, and then adding a second kind of drug. But, and this is crucial, while that combination seems to help people live longer, it also, well, it raises some serious flags about side effects, especially for the heart.
That's exactly right. It's one of those situations where you have clear benefits against the cancer itself, but those don't come free. There are potential downsides that really need careful thought for every single person.
Okay, so let's start with ADT, androgen deprivation therapy. Based on what we've seen, what's its main job here?
Well, basically, ADT works by cutting off the body's testosterone supply, or at least drastically reducing it. Prostate cancer cells, you see, they often feed on testosterone to grow. So lowering those levels can really slow the cancer down, especially once it's spread beyond the prostate. It's a foundational treatment in many advanced cases.
Right, the cornerstone, as you said. And then the sources talk about adding another type of drug when things are more advanced. Why do that? What does that bring to the table?
The main reason is improving survival. Simple as that, really. Studies show that when you combine ADT with one of these second agents, patients with advanced prostate cancer generally live longer than if they just got ADT alone. That's a pretty significant
Is
finding.
longer survival.
Hmm.
But now, the important bit you mentioned. Our material talks about challenging side effects with all these testosterone-blocking drugs. What kind of general challenges are we talking about?
Well, it can be a whole range of things affecting, energy, maybe muscle mass, bone health, even mood sometimes. But the information we're really digging into today puts a big spotlight on the heart, the cardiovascular system. Because testosterone does more than just fuel cancer, it plays roles elsewhere, including in keeping your heart and blood vessels healthy. So messing with it can have knock-on effects.
And focusing on that heart aspect, the review of studies we looked at seemed to suggest those risks get worse when you combine the drugs. Can you expand on that a little?
Yes, that's what the data points towards. Using ADT plus another agent seems to potentially amplify the risk of cardiovascular events. We're talking things like potentially heart attacks or strokes. And this is really important because, let's face it, many people diagnosed with advanced prostate cancer might already have some heart issues or risk factors to begin with.
Right. So this isn't just a minor side note. It sounds like a major consideration for doctors and patients trying to figure out the best treatment plan.
Exactly. You're trying to extend life, control the cancer. Obviously, that's the goal. But this potential for increased heart risk with the combination therapy adds, well, a serious layer of complexity. It really drives home the need to look at the whole picture for each patient, personalize that treatment.
Okay. So putting it all together, what's the fundamental trade-off here based on this info?
The core balance, really, is weighing the potential for longer life that the combination therapy offers against this increased risk to cardiovascular health that might come with it. It's choosing between maybe a more aggressive cancer attack versus protecting the patient's heart and overall condition.
So if you're facing this, or someone you know is, and you're looking at this data, longer life potentially, but higher heart risks, what are the absolute must-discuss points between a patient and their doctor?
That gets to the heart of it, doesn't it?
Yeah.
Key things would be, well, what's a patient's current heart health like? Any pre-existing conditions? Their general fitness? What specific second drug are we talking about? Because they might differ slightly. And just having a really open, frank conversation about the potential gains versus the specific risks. It all points towards needing a very, very tailored approach.
Really crucial points to consider. Thanks for breaking that down. And for you listening, this deep dive really highlights how complex treating advanced prostate cancer can be. It's a stark reminder that these decisions often involve weighing different potential outcomes, different risks, and figuring out what matters most for the individual. As you think about this, what do you think is the single most vital question a patient in this situation should be asking their doctor? Definitely something worth considering.